Ladies and gentlemen, please give a warm welcome to Susan Salt. All right. Is that your award that you brought with you?
Yes, I wondered if some people might like to see it later. So I do always feel a little bit embarrassed with it because it wasn't something that I expected, and I actually don't really feel it's my award. I think we'll talk about that probably in the second half, because I don't think this is just about me. This is about an awful lot of other people.
Okay. Susan, welcome to St Mary's. Welcome to Sundays at 7. It was a few weeks ago that I got in touch with you and asked you for some background information and some of your early memories. And you told me that church and a church schooling was very important for your mum, and it became the foundation for your faith in God. You also told me that your father had a complex mental illness for most of your childhood, so you became a kind of carer from a young age. Tell me a little bit about your dad's situation and how you felt it set you on a course to be a doctor.
So my father was a complex character. He had his first nervous breakdown when I was about 6 months old. I don't think it was my fault, although, you know, you do worry. But he was someone who lived for a very long time with anxiety and depression. He also had meningitis when he was a young adult. And there was a question mark about whether that had also, that trauma, because it was just at the time that penicillin was becoming widely available. So he was very fortunate, but he talked about it quite a bit, the experience of how ill he was, how frightened he was, and whether that also set him up with some trauma. So by the time I was 4 or 5, he could no longer work, and he had a second mental breakdown, ended up in psychiatric hospital, although I didn't know he was in the psychiatric hospital, I just knew he wasn't there. And then from that, he lived with chronic depression, but also obsessive-compulsive disorder, which was something that meant that if things were not done in the right order and in the right way, and the rituals that he needed to do to keep his anxiety under control, if they kind of cracked, then that caused him to go into a spiral of real anxiety. He would then go to bed. And I mean, he would go to bed for months. So 3-4 months he would be in bed. And he wouldn't have a bath. And it was a real challenge. And it meant that me and my brothers, I have 3 brothers, in a sense had to help my mum keep the house running. So we were all involved in keeping the house running.
Your age then?
So by the time I was 8, I could cook a meal, I could do the washing, the ironing, because we were a very traditional family. I was a girl, so I had to do all those things. Hated it, can I just tell you. I'm quite a tomboy. I'd rather be doing the gardening, but hey-ho. And my brothers would be the ones doing the gardening, and all of us helped with the cleaning and all those things. But my father also needed our support, and we also had to learn how to help him to function. And so really from the age of 8, 9, I was very much aware of how to help him keep calm and do what he needed to do. I got quite angry when I was a teenager, you can imagine. And I was very angry with the medical profession at that point, because I felt, because he would be really not very well, and then he'd have an appointment with a psychiatrist. And he'd get up, he'd have a bath, he'd have a shave, and he'd go to the psychiatrist. He clearly told the psychiatrist what the psychiatrist needed to hear. And then he'd come back, and nothing would change. And I was really angry as a teenager about this. And I was quite angry. I thought, I could be a better doctor than that. So that kind of set me on a course to say, yeah, I could be a doctor. And I promised myself 3 things as a teenager. One was that if I said I was going to do something, I would make sure I did it. Because one of the things that used to happen quite regularly, and I'm sure many of you have got this experience, of, an official person will say, I'll ring you at this time, or I'll ring you on this day. And often it didn't happen. And if that happened for my dad, then that actually had consequences for weeks and potentially months later. So I resolved that if I said I was going to do something, I would do it. And even if it meant I couldn't actually give the answer that was needed, that I would still make sure that a contact was made. The other thing I resolved was that I would always try and listen, not just to the patient, but to their family, and hear their side of the story and invite that side of the story. Because that was something that I felt as a teenager was never heard, what the consequences were for us of my father's illness. And the third thing was to be curious, that I would always ask more questions. Because one of the things that was a real challenge was neither at school nor in church did anybody ever ask where my father was, and no one ever actually asked what was going on at home. And I'm not sure that I would have been very honest with them if they'd asked me as a young child or as a teenager, but nobody was curious that this family...
It would have been nice to have been asked.
Yes, that nobody was curious that this family turned up, and we went to church every Sunday without fail. It was exceptional if we didn't go to church. I was at school, but no one ever quite asked, why was your father not at a parents' evening? Why was your father not at a concert? As I say, I probably would have been dishonest, but it would have been nice to have been asked.
Yeah.
Yeah.
You said that you'd always known that there was someone looking out for you other than your parents, but it wasn't until medical school that you explored faith matters more deeply. So how did you arrive at a solid faith for life?
So I've always, so I was brought up to go to church. I went to a very Anglo-Catholic church, so that meant a church where the priest was known as Father, always wore his cassock, and actually for most of my childhood and being a teenager, only boys and men were allowed to do anything in a church service, which was really, really annoying as the only girl in my family. My three brothers were there. They could serve at the altar. They could read lessons. They could do lots of things. But as a girl, I was, basically, I could flower arrange, which I can't do, so don't ever ask me to. So that was my experience of church. But even with that, I knew that there was something about God and about faith that was bigger than that experience, which wasn't particularly constructive for me. And when I went to medical school, I was kind of convinced that, right, I'm not going to bother with this church stuff. I was only going to church, let's be honest, as a teenager to please my mum, and also because it annoyed my dad. So my dad always talked about church as God-bothering. He was an agnostic. He wasn't an atheist, but he was agnostic. Mum had a really strong faith, and I really appreciated that as I got older. And I recognised that her faith helped her to keep going in incredibly difficult circumstances. So I went to medical school thinking, forget about this stuff. But of course, I went to medical school in London, and the first person I met was someone who was also a Christian, and she said, should we go to All Souls, Langham Place? I didn't know, yeah, I couldn't think of an excuse not to go. And of course I could speak the language. And so I went to All Souls, and I was the first time I'd gone into a church where there was a table, not an altar, where the vicar didn't wear a cassock, but wore his dog collar and a jacket and trousers. And I heard people talking about the Bible and connecting it to real life. It's not that hadn't happened when I was growing up, but in some ways I was more open to it at that point. And so over the first couple of years at medical school, I realised that actually everything I heard and everything I'd learnt growing up made sense. But I also recognised that actually it was God and the Holy Spirit that had given all of us as a family the strength to keep together and to grow through what was a really difficult and continued to be a really difficult and challenging time with my father.
So you trained for the medical profession and served for 30 years. But in what particular field, and how did your career develop into specific areas?
So one of the things about, I was the first medic in my family. A lot of my female relatives have been nurses, so caring and the nursing profession had been part of kind of my experience. But I was the first person to go and train to do medicine. That was a real shock. It was a shock because I went to London and I was one of only 5 northerners in the medical school where I was. And suddenly I discovered that people in the south didn't even know where Manchester was, let alone Liverpool. And they also thought that Manchester and Liverpool were right next door to each other, and actually were interchangeable. But also I discovered that there was a world that I just didn't understand. So you can imagine that my world had been very organised, very regimented, had involved a lot of caring. And suddenly I was in this place where there was a lot more freedom, but also a lot of different experiences that I had never had the opportunity to have. So it was quite a tough transition for me. And as part of that, I decided to take a year out, and I did a psychology degree, thinking, because I was still thinking I'm going to be a psychiatrist and prove to those psychiatrists that you could do a better job than they'd done. I'm sorry, it was very arrogant of me, but I learned very quickly that that wasn't the case. And then when I came back from doing that psychology degree, I came and finished my training, and at that point, my father in particular was becoming really quite more unwell. My brothers had all left home and had found jobs mainly down south, and I was the only one who was flexible enough to be able to move back. So I actually chose, once I'd finished my medical degree, to come back to Manchester to do my basic junior doctor training, so that I could not live at home, because I was never going to live at home, but that I could keep an eye and help my mum and continue that caring role. When I came back to Manchester, I knew that I would never be a surgeon. I made that decision because I don't know my left from my right. So it's quite good that I'm not a surgeon. So I kind of knew that I wanted to be a physician. And initially I thought I wanted to be a general physician working in a hospital. But as time went on, I realized that actually I loved just meeting people and seeing the continuity and the connections between people and between family and people. And so I trained as a GP. And as I trained for a GP, I met my husband, I got married, and I wasn't quite ready to go into partnership. So I decided that I needed to do some locums. I needed to just dot around a bit, get some more experience. One of the locums was in a local hospice, and it was like I'd come home. It was like the fact that I could do all the medicine that I loved and enjoyed, like listening to people, making connections, asking those questions of, so how's this for, not just for you, but for the family? And to actually be able to follow through on things. And I talked about it as being general practice for really sick people. And because of that, I decided that this is where I wanted to be, and it felt like this is where God was calling me to be. So I was a very experienced junior doctor, because I went back to doing some very junior training. I did some training in cancer and oncology, and I also, interestingly, having had that lovely song, I went down to Mildmay, which is one of the HIV and AIDS hospices down in London, and I did a 6-month stint down caring for the HIV and AIDS patients down there who were at the end of their life. Hugely transformative experience for me. And then from that, I trained up in Yorkshire to do palliative medicine, which is the posh name for caring for people at the end of life.
You've mentioned things
Been around a lot.
that are, to me, very much a roller coaster ride,
Yeah.
ups and downs. And you mentioned your husband. It was during your time as a junior doctor that you met your husband, Neil,
Yep.
who was a part-time chaplain and local curate at the time. You married, as you said, within 6 months and moved to his first living. Then he had a vocational crisis and ended up as a speech therapist working in palliative care, having been a trained GP. That was quite a roller coaster ride. How did you cope with all that?
Yeah, so it's intriguing. So after I'd qualified as a doctor and I was doing my junior doctor rotations, and doctors change jobs every 6 months approximately, I kind of had always thought I wouldn't get married, because having lived my experience of family life and the real challenges of that, I found it hard to trust. I also worried about how you could keep going. I used to admire my mum immensely for the fact that she was married to such a sick man and just kept going and kept loving. And I just kind of thought, I'm not sure I can do that. But then I met Neil. It was a blind date. We were introduced by one of the auxiliary nurses who thought we'd be good for each other. She was right. She completely orchestrated the whole thing. She basically told us that we were both going out for a meal with her, but that when the meal was finished, Neil was to drive, that's my husband, and he was to take her home first and then take me home. And I was instructed I had to invite him in and offer him a tea or a coffee, and that, you know, it was all completely orchestrated. And of course, we were very compliant. We did what we were told. But yeah, one thing followed another. We fell in love and got married. And it was interesting because I believed that my husband's role, his role as a vicar, as a priest, was more important than mine. And I've always thought that. I've always felt that being a priest and being able to be part of that ministry and of bringing God's love into people's lives is a really key role. And so that was also another reason for being, getting involved in general practice, because I thought, well, that will fit really well with me married to a vicar. So it was a real shock about 18 months after we got married that he really had a genuine crisis of vocation, partly because of the pressures of being an incumbent. And literally overnight, he became someone who just couldn't function. So we had an awful day where I said, we've got to take you somewhere. And the church is really not very good at caring for its clergy. So I trotted him off to the area dean. The area dean wasn't in. So I took him to the archdeacon, who happened to live in Rochdale, where we were. The archdeacon wasn't in. So I ended up with the Bishop of Middleton. Knocking on his door, I'm sure he was horrified. But I had to find somewhere to take my husband to say, this man is really unwell. You need to tell him to stop and to give him permission to not take the services on Sunday. And also tell him to go and see the GP, because he's not listening to me, because of course I'm only his wife. And I don't know what I'm talking about. Fortunately, the Bishop of Middleton was fantastic. And so he spoke to Neil at length, got him to recognise that he needed to step back. And so Neil then went and stayed with his parents for about 6 weeks. I couldn't go with him because I was still working. That was really hard for me, because I was left in the vicarage, fending all these questions about what was happening to my husband, and also all the funeral requests, as well as trying to work and trying to, and then going down at the weekends to be with him. And it was during that time that he said, I don't think I can carry on being a vicar, but I think I'd like to be a speech therapist. So we talked about it. I was really, really sad. I was really heartbroken. It felt really deeply uncomfortable to me. But I recognised that, that's where he was. So he went off to Manchester Metropolitan University, trained as a speech therapist. And that was a time when I got a post to become a trainee in palliative medicine. So he would go off to Manchester, and I would go off to Leeds. And we lived right in the middle in Revd Bridge, so that we could go in both directions. And so we were both training in a way. We were both doing things, but he was training to be a speech therapist. I was to palliative medicine. And yeah, it was tough. Okay. What was really encouraging was that during that time, as we moved into Yorkshire, he found his vocation again, and gradually he went back into ministry.
You have 2 daughters. How old are they?
They're 26 and 24.
Right. But you also told me that you had a third child who was stillborn. I know that's something that some people here tonight can relate to. How did you cope with that at the time? And what sort of test of faith was that?
I think it was one of the biggest tests of my faith, if I'm really honest. So you've heard a bit of the roller coaster of the beginning of our married life. And when Neil decided to retrain, we decided that it would not be right to have children until we were both in more stable places. And also, I needed to work to pay for him to be at university. So we'd waited until he'd qualified, and I was almost at the end of my training to be a consultant. And I was over the moon when I got pregnant. And yeah, in some ways for me, it was an affirmation of my femininity. It was an affirmation of our marriage. And it was something that was really special to me. So we went for a routine scan at 18 weeks, and there was no heartbeat. And that scan was done at the hospital where I was busy training. So it was deeply uncomfortable on many levels. It's still etched in my mind. The room and the fact that there was silence from the ultrasonographer. And I knew as soon as that happened that something seriously was wrong. We were sent away, and I was asked to come back a couple of days later, and we delivered our baby son, who we named Joe. My life stopped for a week. I can't actually remember the whole week. But even in the absolute devastation of that moment, and everything for me came crashing down. I couldn't drive, I couldn't do anything. I can remember sitting on the windowsill. We had a cat at the time, and the cat obviously knew, because I'd just sit there, and I would just absent-mindedly stroke the cat. But we had a fantastic retired priest in the parish where we lived. And without question, he said, yes, of course, you can have a funeral. Because officially, Joe didn't exist. He wasn't really a stillborn, although there was a debate about what dates it was. And of course, at that time, which was quite a few years ago, he would be 28 now, we didn't have all the things that we now have for those who have lost babies and who've had miscarriages. But he just said, of course. And so we were able to have a funeral for Joe, which was really important to me. And he's interred in one of the cremated remains plots in the parish where we lived. It took me a long time to get over that.
I'm sure.
And it took me a long time to realize what lessons that I could learn from it. In a sense, you wouldn't wish it on anybody. But from it, one of the things that was really hard for me with my medical hat on was I'd said things because I'd done obstetrics and gynecology. I'd said to women, oh, it'll be fine. You'll have another one. It won't be, playing it down. And I realized with great pain, actually, how awful that was to say to someone else. But it also, I saw the best in people. People were really supportive. And it also opened up a whole set of people who I've had the privilege of walking alongside since. And being able to talk from my heart and connect with those other people, both as a doctor, but also now as a priest. It's costly, it hurts, but it's also such a privilege. And we are knitted together. We are part. Psalm 139 is such a profound psalm. It reminds us that every life, whether that is a life that takes a breath or it doesn't, is important. And of course, we're then blessed with 2 further children.
Yes.
But Joe is still part of our life. And actually, one of the things I've been very encouraging of people to do is name those children. Make them part of your life. It is really hard. When anybody asks me how many children I have, I always hesitate. I nearly always say 2, because I don't really want to open up that can of worms. But just remember that when you do ask someone, remember you may be actually asking them a really painful question, because they may well have 6, 7, or 8.
You served for 12 years as medical director at Trinity Hospice. Is Trinity Hospice for is it children's or adults?
It's both.
Both.
just to confuse you. Yeah.
What are your outstanding memories of that time? Because that is not an easy thing. I get that. So what are your memories?
I think, that's every hospice. Well, in fact, I mean, every team I've ever worked in has been a real blessing and really special. Teams are not easy, but I think my abiding memory of Trinity was the passion, not just of those who were involved in the frontline serving of patients and their families, both adults and children, but actually every single person that was connected to that hospice. And I don't think that's unique to Trinity. I think that's the passion that the volunteers, the fundraisers, and the community had for their hospice. And I remain humbled by the stories of the people who I walked alongside for, sometimes for a few days, sometimes weeks, for a few people a number of years. They were inspiring. They were people and families who'd been given lemon after lemon and after lemon and made lemonade. You know, they were, particularly in the children's hospice where we were looking after children often with multiple complex needs, those families were just inspiring. And yes, I had a certain skill set, so I had certain knowledge and certain things that I could do. And I think one of my skill sets was drawing people out. So in a sense, following through what I said at the beginning about one of the things I'd promised myself was that I would always be curious. I'd always ask, how is this? Not just for the individual patients, but for the family, and not just for the direct family, but those who were really close to that individual. But also to say that I would never promise something that I couldn't do. And so some of it is the stories, and there are more stories than I can have time to share tonight. But I think I'm going to share just one. That was a 22-year-old young man who was an amazingly bright intellectual mathematician who had a very rare tumour that affected his abdomen. And because of that, he had really complex pain, very complex pain. And that was one of my expertise, was managing that kind of very complex pain. We had the most amazing conversations about God, about faith. And he really brought me up short because he was 22. He knew he was going to die. He didn't shy away from that. And he and I used to have the most amazing ding-dongs about why, what's all this about, but also about how he wanted to use it to learn from himself, but also to teach other people. And his biggest concern were his parents. And we spent many hours with him agonizing about, I don't want to leave my parents. I can see how much this is affecting them. But also us having that conversation about how he had that conversation with them. Because he could have it with me, because I was a relative stranger, how he could have those conversations with his parents. And he died peacefully in his own home, because that's where he wanted to be. But he taught me so much about being open to learning and lessons and asking those big questions and trusting God.
It must have been so difficult in those 12 years not to bring all these issues home with you.
Yes, and at that time too, my husband was back in full-time parish ministry, so it was quite an entertaining time because, and we used to joke actually that when the phone went, did they need Neil to do the last rites, or did they need me a bit further, a bit earlier on? And our two daughters they're always very rude to me, which is great because they keep me grounded. And they used to say, "You are the worst doctor in the world, Mum, because every single patient you ever look after dies." And I said, "Thanks a lot." But they were right. They didn't mean it. They actually did think I was quite good at what I did. But what was fantastic is that quite often they had to come in with me because Neil would be out at a PCC meeting or something else, and I'd be called into the hospice. They lived with death and dying and conversations about death and dying over the dinner table, people's great funerals and all the rest of it. So they don't have any issues about talking about death and dying. Probably blighted them for life, but I'm sorry about that. But yes, it was hard at times, and particularly because my husband was one of the local vicars in the area that our hospice served. It could be really confusing. So often people would say, "Hi, Susan," or "Hi, Dr. Salt," and I'd be going, "Do I know you from church? Do I know you from the hospice? Where have I met you before?" I got very skilled at saying, "So how's it going?" And trying to work out where I knew the person from, because often it was relatives and not actually the patients. And of course, all the patients and relatives had the advantage. There was only one of me, and there were we had 28 beds, so there were a lot of them. So it was difficult. And there were occasions when, and my husband was really good, because there were occasions when it was quite hard for me not to think that everybody who had a cancer diagnosis or a progressive illness diagnosis was dying at that moment. And my husband was really good at reminding me, as all of you will know, that cancer is not a terminal diagnosis for many people. Many people survive cancer. Many people actually are much more likely to die of respiratory disease and heart disease. Occasionally I needed to be reminded that, not everything was that black, if you like. And so that having regular breaks, but also, and that's probably one of the reasons why towards the end of my career, I recognized that that God was calling me to do something else, and that was to become ordained. So, and part of that, I think God recognized that I needed to see the joy, and I needed to see the happy things, marrying people, baptizing babies, and having joyous conversations, as well as a myriad of, very sad and challenging conversations. So.
Now we come to a very topical and important question at the moment. As a Christian and a previous hospice worker, can I ask you what your thoughts and concerns are over the assisted dying bill that is going through Parliament at the moment?
So the first thing I want to say is I think this is really difficult. Death and dying are really difficult topics. We still don't talk about them very much. We'd rather talk about someone kicking the buckets or passing away or going to sleep rather than they've died. So that's the first thing, and I think we need to acknowledge that. We are a society that denies death, that most of us hope that we're going to live not quite forever, but that death is over there somewhere, right over there on the horizon, and therefore we don't want to talk about it. And I think the other thing is that very often people fall into the trap of saying, if we talk about death and dying, that means it's going to happen. And so that was often a conversation I had with families in particular, that, you can't talk to them about dying because that means they'll think they are and then they'll stop living. And actually, it was also such a relief to be able to say, I know this is going to end in death, but I'm not ready quite to do it yet. And then we say, yeah, no, great. And many of you will know the old adage that hospices are all about life, not about death. However, death is inevitable. It's going to happen to every single one of us here. I'm sorry if there's that bad news for you, and I probably should have broken that to you better than that and given you a warning shot. But hopefully I've done a few warning shots. But one of the issues that we have is that in terms of ethics, We have autonomy, i.e. that idea that we are able to make good choices and that we should be allowed to make choices. And justice, which is on the balance of that. Because if you make a choice, your choice will have implications not just for you, but for your family, for your friends. And most of our choices are probably good choices, and actually whatever the implications are not too much serious a consequence. But there is justice, because every choice we make has a consequence. As a Christian, I don't believe that we have complete choice in the sense that God is asking us, calling us, encouraging us to grow in our own self-awareness and in our ability to be the best version of ourselves. We have a choice, of course we do. We don't have to respond to that call. But I know from my own experiences, not responding to that call, you are diminished because of it. God's way is a far better way than our way, and it's beyond our imagination. If you told me, even 10 years ago, that I'd be sitting here talking to you with a dog collar on, I'd have roared with laughter, because I was a medical director. I was the clinical lead for Lancashire and South Cumbria. I was completely embroiled in medicine. But God's way was different, and I recognised that it was the right time and the right call for me. So, when it comes to end-of-life care, I am very concerned about the assisted dying bill for a number of different reasons. I completely recognise why people would seek to end their life at a time that they would want to do that, because people are frightened and scared, and not everybody gets access to people who can support them, listen to them, and enable them to express what they need to express in the way they want to express it, and to manage their symptoms as well as possible. But we don't know when death actually happens. There are myriads of studies that show you that doctors are appalling at working out the prognosis of people. So there are people who are told they've got 6 months to live and they're dead within a week, and other people that are told that they have 6 weeks to live and are still alive 4 years later. And that's not because the doctors are terrible at what they're doing, it's actually the fact that we actually don't know. And as a Christian, I believe that's because God is ultimately in control. Yeah. And I have seen more miracles happen, not in terms of people being healed, but of people being given the time that they need to do things that they need to do, and other people who have actually had a shortened life because actually that's what's right for them. So for us to artificially cut short someone's life is of great concern to me. But the other thing that I really worry about, having sat with many people who have died, is that it is really hard, and please don't anybody think that I don't think it's hard. I've sat with both of my parents. I do know how hard it is, or I know how hard it was for me. But those times of kind of where people are going in and out of unconsciousness, they're really frail, they look really ill. I don't know what's going on. And as a priest, I don't know what's going on. But I have a sense that in that time when, okay, may not be talking and we may not be physically doing things, spiritually, things will be happening. And one of the things that we are not good at, particularly in Western society, is recognizing that we're not just body and mind, we're also our spirits. And our spirits are part of us that we nurture through our faith, we nurture through what we do in terms of enabling to look after ourselves, but also in actually what we do about making sense of our life. You know, what is life about? Why are we here? What's this all about? And for me, in those moments where we kind of think, looking on as people who are well and able to speak and all the rest of it, we might well say that's wasted time. But I don't think it is. And so again, to foreshorten that really worries me. I think the final thing that really worries me is who is going to administer or prescribe these drugs. And I can tell you, as a palliative medicine consultant, who use lots of really toxic drugs, a lot of which you would, a drug dealer would pay me a lot of money for, It's really hard to kill someone. It's really hard. I don't think people realise how hard it actually is to guarantee to kill someone. And so for me, who's going to prescribe them? And how is that person going to feel? And how are the family or the person who administered it going to feel? Because there's no way back. Once these things are taken and someone has died, you can't undo it. And I do worry hugely for the nursing profession and the medical profession, because if it is doctors and nurses who do that, how can families trust that the conversations that I used to have about saying, yeah, we need to put your painkillers up because you're in pain, it may make you feel a bit more sleepy, but you need to trust me that we're trying to do our best to keep you comfortable. It's a very difficult thing to have that conversation if people are thinking, well, she might just think I'm just going to give you a bigger dose just because I want to shuffle that one off. And finally, you probably get the idea of where I might be sitting with all of this. I have had a number of people throughout my career who have said to me, I've had enough. This is just awful. And please believe me, I have walked alongside people who have suffered greatly. But we found a way, not necessarily of controlling their pain and getting rid of it, but of managing it so it is livable with. And a lot of that is not been about painkillers. It's actually been about listening to the story and allowing the expression of perhaps the frustration, of the fear, of the anger, of why me, why now, but also of being able to talk to family and friends and have those honest conversations. So I am really concerned, and I am not sure there is any legal structure that will protect those who are most vulnerable from feeling pressured into ending their life prematurely.
Thank you so much for sharing that with us, because it's a contentious issue. I've heard people saying, yeah, but with things like syringe drives and what have you, you can help people along. But this is a bigger issue than just that.
And I would challenge that comment about syringe drivers helping people along. I've really wrestled with that for most of my career, of the kind of what's called the doctrine of double effects, that you prescribe something that may shorten someone's life, but with the intention that you're trying to get them comfortable. I have come to the conclusion that I don't believe that doctrine of double effect. I think that when we are using drugs appropriately for the right reasons to manage physical symptoms, then actually the fact that someone may, that we're not shortening someone's life, we are just enabling them to have a more comfortable and dignified death. Syringe drivers do not shorten people's life. In fact, my experience is that syringe drivers lengthen people's lives because they make them more comfortable, therefore they can go on. Not necessarily for, I'm not saying they lengthens people's lives for weeks or months, but certainly potentially lengthens their life for a number of days, possibly hours. So some of the things that are myths about strong medicines that we use, I would like to challenge and say palliative care actually lengthens people's lives. It doesn't shorten them.
Thank you for that. You retired from NHS work in March 2019 to train for the ministry.
Yep.
And then shortly afterwards, in 2020, COVID struck, and you returned to work at the Blackpool Teaching Hospital. You needed to self-isolate from your family whilst helping during the crisis. Did you recognize that God was calling you to come back so quickly? And how difficult personally was that whole time for you?
I think God has a horrendous sense of humour, can I just say? Sorry, I shouldn't say that. I'm a vicar, I shouldn't be doing that. But I had really, really struggled to let go of medicine. I had really struggled. It felt to me as though God was asking me to jump off this beautiful tanker that I was part of driving. And literally, to jump off, I had no idea whether there was a life belt or hopefully some form of lifeboat. And I had really struggled. And when I'd first put myself forward for ordination, I'd kind of told everybody that it was ridiculous. It was stupid. I had a really, I had a vocation. I did. God had called me to palliative care and to hospice work. I had a vocation that I did not have another one. Lots of people told me I did have another vocation, and I gave in and went and said things to people, and I kept telling them that it was wrong, and they kept telling me, no, yeah, you're wrong, God's right. But I initially thought that when I went forwards for ordination training, I trained part-time, so I carried on being a medical director and did my theology training, which is a bit mad, but it was okay. And I really thought that when I got ordained, I would be a part-time medic and a part-time priest. God said no. Very clearly made it almost impossible for me to carry on as a priest, as a doctor, and very much made it very clear to me through various circumstances that you are to be a full-time priest. So it had been really, really painful for me to leave the hospice. It had been really painful for me to lay down my medical credentials. I'd had to fight with the GMC to get myself off the register, because I deliberately said, no, I'm going to take myself off the GMC register so I can't be tempted back, because I think I would have gone back. So, and the GMC, quite funny, would have said, well, what have you done wrong? And I had to have references from so many different people to say, she's not jumping ship because she's done something wrong. She's actually leaving because she's going to train as a priest. So I'd done all of that. I jumped through all those hoops. And then COVID struck. And within about, I don't know how, probably within a week, the government sent out this email to all people who had just recently come off the register to say, would you consider coming back? And I opened it. And I almost burst out laughing because I thought I had really struggled to let go of medicine, and suddenly in front of me, sitting on my computer, is this email saying, would you consider coming back to work as a doctor? And I kind of, first of all, thought, no, I've left. I'm not going back. But in my head, there were these little voices saying, but you're a palliative medicine consultant. You know about death and dying. You know that there's going to be an awful lot of death and dying, and you know how to help people and to train people to manage that. So you need to go back. And so I had very long conversations with my husband, because we are carers for my father-in-law, who, but in that time was in his late 80s and quite vulnerable. And I said, if I do go back, then I'm going to have to go and live away from you all, because I couldn't live with the idea of bringing COVID back and giving it to my father-in-law. And so we decided that, okay, say yes. And within a day, obviously all the trusts had been given all the names of all these doctors that said they'd come back, and they'd seen my name, and so Blackpool Teaching Hospice going, we're having Susan back. So within a week, I was back in Blackpool. I was staying in a B&B on the seafront, and I was back in the hospital where I didn't spend a lot of time because I was the medical director of the hospice, but I was a consultant there, and I did go and see patients in the hospital. So I knew a lot of the colleagues. And I went back, but I went back with my dog collar on because I was ordained a deacon at this point. And I went back and I worked across the chaplaincy and mainly ITU. And yeah, I don't think I've completely processed a lot of that. To walk down a hospital corridor that you knew really well with nobody, I mean nobody in it other than you, where every door of every ward was shut and that you had to get access to go in. And no ward was allowed to mix with another ward. So one of the things that I felt called to do was to be the listening ear for all the staff who had friends on different wards, but they couldn't see them. And they weren't allowed to see them. They came into work. They came into work terrified. They were terrified whilst they were at work. And we had all the issues around PPE and all the protective stuff. And also the fear of, we didn't understand this virus. We didn't know how infectious it really was. We didn't understand why it was killing so many younger people. And people were terrified, but they couldn't talk to their colleagues because they were in different wards. But also, when they went home, some of them found it really difficult because they were frightened to infect their families, and some of them were self-isolating just as I was. And others found that they were just annoyed by what was going on and the questions, and they couldn't answer them, but they felt they ought to. So there was a lot of listening and talking to staff, but also teaching them around how to manage death and dying, because that's my bread and butter. And that encouragement around allowing people to talk about death and dying. And when they said, "Am I dying?" rather than saying, "No, you're not," to say, "What makes you ask that question?" Those very simple things that, if you can do that, actually allows someone then to talk and to explain what's going on. To support people as they had the impossible conversations, which we'd always taught to have face-to-face, suddenly over a phone or over Zoom. And helping them to navigate that complexity. But also it was a huge transformative experience, because suddenly every ward needed to think about death and dying. And I had the privilege, in a way, of being able to help and support some wards that very rarely had people dying, to really think about how to do that well. It was a very mixed experience. I did quite a lot of chaplaincy work. I did a lot of praying with patients, but I also had a lot of time to do some of the medicine, and I would also be helping advise about, give this medicine or that medicine. So it was interesting.
Susan, an hour goes like that.
Yes,
it
absolutely.
really, really does. There were other questions, but you have covered so much wonderful ground. I know you were awarded the British Empire Medal for your work, but you said to me before it wasn't for you, it was for everybody who worked in that system.
Yeah, because one of the things that I really found really difficult was this idea of front lines and battles. COVID wasn't about a battle. It was about all of us together, pulling together, following the guidelines. It wasn't about some people being on the front line and others not. It was about all of us together. And yes, I suppose I was someone who, chose to go and live away from home, and had the privilege of being able to help a trust and a diocese, because the other thing I did whilst COVID was I was on the COVID task group for Blackpool Diocese, and I wrote all the guidance for the clergy and the churches around how to safely carry on ministering. That was a privilege, but I wasn't doing it because of that. I was doing it because I was here to help. And actually what this is for every single bus driver, and for every single person who kept the shops open, and for every single cleaner in the hospital who kept our wards clean, and for the security staff who I watched as they turned away relative after relative after relative and said, "You cannot come in." And that this BMM is for all of them who faithfully did all of that.
Susan, our time has run out, and there were other things, but you've covered such a lot. Thank you for coming and sharing your life with us. Ladies and gentlemen, Susan Salt.